Hi, I'm Dr. Breen with the Breen Center of Optimal Health. In this video, I want to help you decide on the proper form of estradiol that you're going to use. So I had a woman ask me the other day, hey, Dr. Breen, you have me on an estradiol capsule. Can I be switched to a cream and what's the advantage? And it's a great question because you can deliver typically estrogen in three forms. You can give it orally in a capsule. You can apply it topically through the skin via cream or an estradiol patch, or some doctors even insert pellets. And I'm going to give you my opinion and you can discuss it with your doctor, but this is what I do with our patients. So the number one delivery system for taking estrogen is through a capsule. And that's contrary to what a lot of doctors are taught and what a lot of doctors believe. They're told that, giving estradiol in a capsule increases your risk of blood clots. And that's not actually true. That's actually false. The reason why you want to take estradiol in a capsule is it has, if you look at all the data, all the published science, there are additional cardiovascular benefits to lipids, to reducing your risk of having a heart attack or stroke, that you get taking it orally that you don't get when you take it topically. Now, that's very nuanced. And Dr. Rouget, who spent his entire life looking at the literature, has clearly made a case that the capsules and taking it orally is superior to any other form. Now, do I have patients who use estradiol topically, either via cream or a patch? Yes. Now the question is why? Well, some women are sensitive to estradiol. They have the 5 Bs, right? So the 5 Bs of too much estrogen, if a woman's sensitive, are they're bloating, so they get really bloated. They can bleed vaginally, so it can cause a lot of vaginal bleeding, which obviously you don't want. They can get severe breast tenderness, which is uncomfortable. One of the Bs is bitchiness or irritability, and then they could break out. That's the 5th B with acne. Now, typically we don't see that often, but women that are sensitive to estrogen, if you give them a capsule and you have to adjust their dose, obviously they have to throw out the capsule, which is not ideal. So if you give them a cream and they're using 2 clicks twice a day of an estradiol topical cream, you can simply tell them we'll go down to 2 clicks once a day or 1 click twice. It's easier to adjust. Now, what would be an advantage of using a patch? And so I have patients who have cognitive decline or they just have poor compliance. I'll talk to women, oh my gosh, I forget to apply my testosterone, or I forget to put on my estradiol cream. And for that reason, you can give them something called the Vivel or Minivel patch that comes in a generic estradiol patch, which is a little bit cheaper. And you just basically apply that to your lower abdomen and you change it out twice a week and you'll get really good levels. So there's a case to be made for all 3 forms of estrogen. I would tell you that primarily, if you care about your cardiovascular health, and if you're a woman, you should, because of every woman that dies of breast cancer, 12 will die of cardiovascular disease. So it's still the number 1 killer in women. You want to take estradiol orally. You do not have to worry about taking estradiol and getting blood clots. It doesn't cause blood clots. It was Premarin that caused blood clots, but Premarin is not estradiol. Those were conjugated estrogens from a horse that contained equilin and 7 other compounds foreign to the human body that increase the clotting risk, albeit very, very small. It's almost statistically insignificant. So we don't worry about blood clots when you take estradiol orally. But we do have patients who use topical estrogen, and that's fine. They'll still do well if you're eating clean, you're exercising, and you're doing all the lifestyle things that we ask our patients to do. You're going to get a reduction in your cardiovascular risk regardless. So I hope that helps you understand if you're taking estrogen, don't fear oral estradiol. You should want to be on it. You should want to tolerate it because it's the premier and the best form to actually take it. And if you have any other questions, feel free to contact our office. We help walk you through it. If you like this video, please click the like button. If you like this content, subscribe to my channel. We're going to be putting out a lot of content just like this. And if there's someone that you know that's on estrogen that you want to share this with, certainly share it with them. And that's it for today. So we'll see you soon. Have a great day.
For more details and information, please contact us at 877-721-0047 or visit the FAQ section of our website at www.breencenter.com.